I'm joined by Dr. John Ford, an academic public health doctor at the University of Cambridge. Good evening and welcome, John, to GB News.
Good evening.
Now, we've heard a lot today from Sajid Javid. We've heard that, he'll sack inefficient managers of hospitals. But just before we get to that and the structure and the management of the NHS and the money that is needed to deal with this backlog, which, by the way, we're told could go from 5.5 million waiting for operations to 13 million. Do I have a point in saying that if more people opt out of the NHS for relatively routine operations, that would actually relieve the burden that we currently have?
Well, I think fundamentally this type of approach increases inequality. We've tried this before in Scotland in the 2000s with using more private healthcare. We found that people in poorer areas and older people were less likely to get appointments. So I don't think it's quite as simple as just opening up the private sector.
But if there are 100 people in a market town in England waiting for hip replacements, and if 30 of them decide to go privately, doesn't that give the other 70 a chance of having an operation before a 2-year wait?
The thing is that the NHS is already working with a number of different private organisations, private hospitals, to address the backlog. This has been happening for years. The idea that the NHS doesn't work with private companies is just not true. And the NHS is very good, actually, at managing these efficiencies and ensuring that priority goes to those people who need it the most, rather than whoever's been waiting the longest.
So if the NHS is very good at it, and I do understand we're just coming out of a very difficult pandemic, if the NHS is that good at it, why do some people think the waiting list could rise to 13 million over the course of the next few years?
Yeah, so the NHS is facing this unprecedented amount of backlog in terms of elective procedures, diagnostics. It's nothing that the NHS has dealt with before. Yeah. We had a waiting list before we entered the pandemic. It's grown. It's not going to be solved overnight. But actually, there's NHS plans in place in terms of elective hubs, diagnostics hub, to try and deal with this backlog. And I think actually the way to do this fairly and equitably is if we all buy into it and we don't end up with a 2-tier health system in the country.
All right, well, I think, John, we'll agree to disagree on that, because I just think the more people that opt out, the less pressure there is. But I do understand your point that, of course, the NHS is using private provision as much as it possibly can or where it suits. But to the bigger point about NHS management, kind of what Sajid Javid is saying is that if certain hospitals don't get waiting lists down, he's going to sack the senior managers and bring somebody in from business to take over. Is that realistic within the NHS as it's currently structured?
Well, I think Sajid Javid missed a huge opportunity here during his speech. We heard a lot about healthcare activity, a lot about appointments and operations. We heard almost nothing about prevention, about making us healthier and living longer. And this idea that actually the problem is at the feet of NHS managers just doesn't quite hold water. We know that the NHS is one of the most affordable healthcare systems in the world. It performs really well compared to other high-income countries. And so actually pointing the finger at the NHS managers isn't particularly helpful. Undoubtedly, there's efficiencies that can be made. Undoubtedly, there's learning to be made from other industries and from other organisations, but actually I don't think it's all that helpful. And I think a bigger focus on prevention and on trying to address this inequality gap we see across the country would have been more helpful.
And finally, can I ask you, when I look at numbers that we get from, say, France and Germany, countries on a very sort of similar living standard to us, and roughly similar amounts spent on healthcare, we go above them, below them, but roughly similar. Is it fair to say that the French and Germans get better bang for their buck when it comes to cancer, heart and strokes?
To be honest, we're on a bit of a par. So the Commonwealth fund compared to living countries, high-income countries, which would be our comparators. The NHS tends to come out number 3 or 4 out of 11. The US tend to perform dreadfully, so they tend to come bottom. And the Scandinavian countries tend to come towards the top. And actually, the UK is upper middle compared to other countries. So we do pretty well in the UK. There's much more that we could be doing. And I think actually what we missed today was Savage Javid not talking about the things which actually make us healthy, which are having a good childhood, having a good education, having a meaningful job with good income, good housing, access to green space, and having a healthy lifestyle. And actually, I think more of that in the health secretary speech would be better rather than focus on disease and healthcare activity.